A few years ago, I sat across from a colleague at a medical conference dinner. He was a cardiologist, 63 years old, in excellent shape, the kind of physician other physicians go to when they need advice. Somewhere between the salad and the main course, the conversation turned personal. Someone at the table mentioned a sore knee, reached into her purse, and pulled out a small bottle of ibuprofen. She shook 2 tablets into her palm like it was nothing. My colleague watched her, set his fork down, and said something I have never forgotten. He said, "I am 63 years old, and I will not touch that drug. Not anymore. Not at this age. And if my patients knew what I know about what it does inside a body over 60, most of them would feel the same way." The table went quiet. This was not some fringe supplement or experimental medication he was talking about. He was talking about one of the most commonly used drugs on the planet. A drug that sits in virtually every medicine cabinet in every household in every country. A drug so familiar, so ordinary, so universally trusted that most people do not even consider it a real medication, and that is precisely what makes it so dangerous. I am Dr. Arya, and on this channel, Senior Health, I talk about the health truths that matter most after 60, the ones hiding in plain sight, inside your daily habits, inside your kitchen, and sometimes inside the bottle of pills you reach for without a second thought. Today I need to talk to you about non-steroidal anti-inflammatory drugs, NSAIDs. You know them by their common names: ibuprofen, naproxen, Advil, Motrin, Aleve. You've taken them for headaches, for joint pain, for backaches, for the stiffness in your knees that greets you every morning. You have taken them casually, frequently, sometimes daily, because they are sold over the counter, because no one ever told you to be cautious, and because you assume that anything you can buy without a prescription must be fundamentally safe. That assumption is wrong, and after the age of 60 it becomes genuinely dangerous. Let me walk you through exactly what happens inside your body when you take an NSAID, because the mechanism is what makes this so critical to understand. NSAIDs work by blocking an enzyme called cyclooxygenase, or COX. This enzyme produces compounds called prostaglandins, which are responsible for generating inflammation, pain, and fever. By blocking COX, NSAIDs reduce all 3. That is why they work. That is why they feel like a miracle when your knee is throbbing or your back is seizing. The pain recedes. The swelling goes down. You feel better within an hour. Problem solved. Except it is not solved. Because prostaglandins do not only cause pain and inflammation, they also perform critical protective functions throughout your body, functions that you never feel, never notice, and never think about until they are compromised. Prostaglandins maintain the protective lining of your stomach. They regulate blood flow to your kidneys. They help manage the tone and flexibility of your blood vessels, and they play a direct role in controlling your blood pressure. When you take an NSAID, you do not selectively block the prostaglandins responsible for your knee pain while leaving the protective ones intact. You block them all, every single one. And in a body over 60, where the stomach lining is already thinner, where kidney function has already naturally declined, where blood vessels are stiffer and blood pressure regulation is already less precise, removing those protective prostaglandins creates a cascade of vulnerability that most people are completely unaware of. Let me start with your heart, because that is what a cardiologist sees first, and it is what concerns me most. In 2015, the United States Food and Drug Administration took the unusual step of strengthening an existing warning on every NSAID sold in the country. The updated warning states explicitly that NSAIDs increase the risk of heart attack and stroke, not may increase, not slightly elevate, increase. The risk begins within the first week of regular use and grows with continued use. For adults over 60 with any existing cardiovascular risk factors, and that includes the majority of people in this age group, the risk is significantly amplified. A study published in the British Medical Journal found that current use of NSAIDs was associated with a 20 to 50% increased risk of major cardiovascular events compared to non-use. These are not rare medications taken by a small population. These are pills that hundreds of millions of people take routinely, often daily, believing they are harmless. Now let me explain the mechanism, because it is not random. When NSAIDs block prostaglandin production in your vessels lose some of their ability to dilate properly. They constrict, blood pressure rises. In a younger person, this effect is usually modest and temporary. In a person over 60 who is already taking blood pressure medication, this NSAID-induced constriction can raise systolic pressure by 5 to 10 points, sometimes more. Enough to push a controlled reading into an uncontrolled range. Enough to make your antihypertensive medication appear to stop working. And here is what happens next. Your doctor sees the elevated pressure at your next visit, does not connect it to the ibuprofen you have been taking every morning for your hip, and increases your blood pressure medication dose. Now you are on a higher dose of one drug to counteract the invisible effect of another drug that nobody asked you about, because it is over the counter and therefore presumed irrelevant. The interaction is real. The consequence is measurable. And it happens in exam rooms every single day. Let me move to your kidneys. because this is where the damage accumulates silently in a way that terrifies nephrologists. Your kidneys filter approximately 180 litres of blood every day. To do this effectively, they depend on a precise balance of blood flow, regulated in large part by the same prostaglandins that NSAIDs suppress. When you take ibuprofen, blood flow to the kidneys decreases. In a young, healthy kidney, this reduction is minor and temporary. In a kidney over 65, one that has already lost roughly 30 to 40% of its functional capacity through normal aging, that reduction in blood flow can push the organ past a tipping point it cannot easily recover from. Chronic NSAID use in older adults is one of the leading preventable causes of acute kidney injury and accelerated chronic kidney disease. And the cruelest part is this: your kidneys do not send pain signals when they are being damaged. There is no ache, no sharp warning, no symptom you can feel. The damage accumulates visit by visit, blood test by blood test, until one day your doctor looks at your creatinine levels and tells you your kidney function has declined significantly and asks you if anything has changed. You say no. Nothing has changed. You have just been taking 2 Advil every morning for the past 8 months for your arthritis. And nobody, including your doctor, ever told you that those 2 small pills were quietly dismantling the organs responsible for filtering every toxin out of your blood. Now let me address your stomach, because this is where the most immediately visible damage often occurs. The protective mucous lining of your stomach depends on prostaglandins to maintain its integrity. When NSAIDs block that production, the lining thins. Stomach acid, which is always present, begins to erode the unprotected tissue. In a younger person, this might cause mild heartburn or discomfort. In an adult over 60, particularly one also taking aspirin or blood thinners, this erosion can progress to gastric ulcers and gastrointestinal bleeding. A study in the American Journal of Gastroenterology found that adults over 65 who regularly used NSAIDs had a 3 to 5 times higher risk of serious gastrointestinal bleeding compared to non-users. Serious bleeding at this age is not a minor event. It can require hospitalization, blood transfusions, and emergency intervention. And in many cases, the patient had no warning symptoms at all. No stomach pain, no nausea. The first sign was black stool or sudden weakness from internal blood loss they did not know was happening. I want you to stop and think about this for a moment. A single over-the-counter drug, taken casually for everyday aches, is simultaneously raising your blood pressure, undermining your blood pressure medication, restricting blood flow to your kidneys, thinning the protective lining of your stomach, and increasing your risk of heart attack and stroke. Not as rare theoretical possibilities in a research paper, as documented, studied, measured consequences that occur with regular use in adults over 60. And this drug requires no prescription. It has no warning label large enough to communicate any of this. It sits on the shelf next to vitamins and cough drops. And nothing about its packaging suggests that for your body, at your age, it may be one of the most harmful things in your medicine cabinet. So what do you do when your knees hurt and your back is stiff and you need relief? I am not suggesting you simply endure pain. Chronic pain is its own health risk. It limits mobility, disrupts sleep, contributes to depression, and accelerates physical decline. Pain management matters, but the method of management matters just as much. Here is what I recommend to every patient over 60 in my practice. First, acetaminophen, known by the brand name Tylenol, is a significantly safer first-line option for pain relief in older adults. It does not affect blood pressure. It does not reduce kidney blood flow. It does not thin the stomach lining. It has its own limitations, particularly regarding liver function, and the dose must be carefully respected. But for routine musculoskeletal pain, it carries a fraction of the cardiovascular and renal risk that NSAIDs do. Second, topical anti-inflammatory creams and gels applied directly to the painful joint or muscle deliver medication locally without significant systemic absorption. Your knee gets the relief. Your kidneys, stomach, and blood vessels are largely spared. This is an option most people do not even know exists, and for localized pain, it can be remarkably effective. Third, consistent gentle movement, stretching, and low-impact exercise remain the single most effective long-term strategy for managing joint pain and stiffness in older adults. It seems paradoxical. You are in pain, and I am asking you to move. But the research is overwhelmingly clear. Regular movement lubricates joints, strengthens the muscles that support them, and reduces inflammatory markers over time in a way that no pill can replicate. Fourth, if your pain is severe enough that you feel you need an NSAID, talk to your doctor first. Not after, before. Discuss the lowest effective dose for the shortest possible duration. Have your kidney function tested. Review your current medications for interactions. Make it a conscious, informed, monitored decision rather than an automatic reach into the medicine cabinet. This week, I want you to look at your medicine cabinet and your kitchen counter. If there is a bottle of ibuprofen or naproxen sitting there, half used, taken casually whenever something aches, I want you to move it somewhere less convenient. Not as a punishment, but as a pause. A moment of friction between the habit and the action. Enough time to ask yourself whether this particular pill today, in your body at your age, is truly the safest option available to you. In most cases, it is not. And now you know why. If this changed how you think about a drug you have taken without question for years, share this video with someone over 60 who reaches for ibuprofen regularly. They deserve to have the same information in front of them. Subscribe to this channel because next week we are going to talk about the hidden danger of mixing common over-the-counter medications, combinations that millions of seniors take simultaneously without realizing they were never meant to be used together. Everything I have shared today is based on current medical research and clinical evidence, but it is general health education, not personal medical advice. Do not stop or change any medication without consulting your physician first. Your health history, your current prescriptions, and your individual risk factors all determine what is right for your specific body. Use this information to open a conversation with your doctor, not to replace one. That conversation is where your safety begins. Take care of yourselves.